Good day, Thorne Ambulance team. Chris here. This video is going to cover our Thorne Ambulance Controlled Substance Accountability Policy, specifically our 911 markets. In these markets, each day when you report to work, you'll find your narcotics safely locked inside your vehicle. First step is to look at your controlled substance vehicle log. And looking at the log, each morning it'll be in your binder or in the compartment locked with your medications. You want to list your vehicle number. If you move from one vehicle to another for a maintenance issue, or it's time to get the oil changed, or whatever the case may be, each time you move vehicles, you'll want to move those narcotics with you as the responsible or primary provider. You'll list your vehicle number, each medication that we're carrying, the quantity of medication, and list the expiration date of the one that expires first. You'll have your oncoming date and time printed. Print the name of the person accepting the medications and the signature. Looking at whoever's going off as you do a visual report on and off to make sure that everything is exactly where you're documenting that it is. Whoever's going off will do the date and time, name print, and name signature. Don't sign off in the middle of the night so that you can lay in the bed the next morning. This needs to be a two-person procedure. Both people go to the truck, sign the accountability as ongoing and offgoing. Can an EMT or advanced EMT sign for the chain of custody or for the accountability for the day of the controlled substances? The answer is yes. You can't use them, but you can sign that they're safely locked where they're supposed to be and accounted for, following the same policy. Next thing we want to look at is our controlled substance medication flow record. This will be used anytime that we administer Valium, midazolam, morphine, fentanyl, ketamine. If we add any additional medications to this, we will certainly expand the form and add those selections. You should have blank forms in your truck with the medication or controlled substance logs and accountability forms so that you have extras at all times. Here you'll select the medication you have, the administration, you'll list your patient. If you have to remove one from service, you break a vial or one expires. Here's a place for you to mark it as expired or damaged. What happened. Up here, of course, whatever it is, you'll put the concentration of the medication and how many milliliters, and the paramedic responsible would sign that. Do not use the narcotics officer or restock. This is for your market manager to fill out as he reviews the forms, make sure the forms are where they need to be, and ensures that restock has occurred. Taking a look at the controlled substance form on a completed patient, we're going to assume that I responded to a patient with a hip fracture using a standing order. Based on the patient's weight, condition, many other factors, decided to administer 100 micrograms of fentanyl. So I select fentanyl. Run number is critical. You must complete this run number on this form. I put my run number 1, 2, 3, 4, 5. As an added safety, if you want to, you can also write that number up here so that whoever's scanning the paperwork makes sure that it's attached to the chart. The concentration of the vial that I picked up out of the container and verified is 200 micrograms in 5 milliliters. I selected administration. Make sure that you put the patient's full name, first name and last name. Here our patient was John Doe, had a hip fracture. He lives at 123 Main Street in Greenville. This is not where you pick the patient up, but what the patient's address at home is. Maybe a California address, maybe a South Carolina address, whatever that patient address comes back to, make sure you list their personal address. Once you get to the hospital, you need to ask the physician to sign. Here we asked Dr. Feelgood. Dr. John Feelgood printed his name and signed his signature. Yes, I know we're running into facilities where you've given this as a matter of standing order and the physician is not comfortable signing it. In this case, pay close attention. You must make sure that the original copy gets back to your market manager. List on this form somewhere standing order, and we will have it carried to Dr. Thorn to sign. If you request a medication redose or you request to give a controlled substance in place in the protocol where it says you have to ask, then that ordering physician will have no problem signing it because he at that point or she ordered the administration of the medication. Next thing, make sure you clearly print your first and last name, and then you'll sign this form. This form needs to be copied, attached to your run sheet, and the original returned to your market manager. So in review, make sure each day both crew members are signing for the accountability of the medication. Make sure you always have extra controlled substance medication flow records, and make sure that you're completing all sections of the flow sheet. Again, looking back at this one, I used half of this, so I showed the amount wasted. Went and got Nurse Ratchet, Jane Ratchet. She verified the amount I was wasting and signed as the witness. So anything you do with these controlled substances need to be documented on this form. Administration to a patient, amount wasted, removal from service, whatever the case may be, that shows a clear chain of what we did with that patient. If you have any questions, please feel free to contact myself or your market manager or your daily supervisor. Thank you.